After 70, life should be about peace, wisdom, and well-being. But what if we told you that some medical checkups, yes, the ones meant to protect you, could actually do more harm than good? Doctors don't always tell you this. But overdosing in older adults can lead to anxiety, unnecessary procedures, and even life-threatening complications. Today, we uncover 5 health checkups you should avoid after 70 that may harm you more than help. Let's begin with the first one. It might surprise you. Chapter 1. Full body scans. The silent stress creators. Many health centers aggressively promote full body scans to seniors. They market it as a peace of mind package, a total scan to catch silent killers early. But here's the truth. Full body scans often find harmless things and create harmful panic. These scans can reveal benign nodules, cysts, or age-related changes that are perfectly normal but still flagged as suspicious. This leads to invasive biopsies, unnecessary surgeries, long waits, and emotional distress, and sometimes serious complications like internal bleeding or infection. Dr. Rita Mann, geriatric specialist. We see seniors scared out of their minds by something that turns out to be absolutely nothing. And worse, the treatment ends up hurting them. Radiation risk. Don't forget, CT scans and similar full-body imaging expose you to high levels of radiation, more than 100 X-rays in one sitting. After 70, the risk of radiation-induced problems outweighs the potential benefit in most healthy seniors. What you should do instead: get targeted tests only if you have symptoms. Ask, what will we do differently if we find something? Discuss alternatives with a doctor who understands geriatric care. Chapter 2. Prostate cancer screening. PSA tests for men over 70. Prostate-specific antigen, PSA, tests are still widely offered. Sounds responsible, right? But in reality, PSA screening in seniors often leads to false alarms, overtreatment, and side effects worse than the cancer itself. Here's why it's a problem. Most prostate cancers in seniors are slow-growing and non-threatening. PSA tests can't tell the difference between aggressive and harmless cancer. A slightly elevated PSA could trigger biopsies, anxiety, and unnecessary treatment. Treatments like radiation or surgery can cause urinary incontinence, erectile dysfunction, infection. Dr. Thomas Green, urologist. We often end up treating a problem that might never have caused any harm, and in doing so, we harm the man. What's the alternative? Skip PSA screening unless there's family history or specific symptoms. Focus on quality of life, not just lab numbers. Remember, doing less is sometimes the smarter choice. Chapter 3. Colonoscopies after 75. A risky gamble. Colonoscopies are life-saving for many, no doubt. But after age 75, the balance tips. And after 80, most experts say it's no longer worth it. Why colonoscopies can be dangerous after 70. Requires full sedation or anesthesia. Bowel prep is exhausting and risky in frail seniors. The risk of perforation, tearing the colon, increases significantly. Possible bleeding, infections, or complications from anesthesia. And again, most colon cancers in seniors grow very slowly. Finding a tiny polyp at age 80 may not change anything, but the procedure could. Alternative approaches. Stool tests, FIT or FOBT, every 1 to 2 years if still active. Discuss your life expectancy, frailty, and lifestyle before any invasive test. Dr. Susan K., GI specialist. We're not trying to scare people away from screening. We're saying, after a certain age, the colonoscopy may hurt more than help. Chapter 4. Mammograms in elderly women. When to stop. Breast cancer awareness is vital. But so is knowing when it's okay to stop screening. For women over 75, and especially past 80, mammograms often detect slow-growing tumors that may never spread or harm them. But once found, they lead to anxiety, biopsies, surgery, chemotherapy, and radiation, all of which carry risks. The reality: most older women die with breast cancer, not because of it. A tumor that would take 15 years to grow becomes irrelevant if you're 80 and otherwise healthy. Should you still screen? If you are over 75, in good health, have 20 plus years of life expectancy, then yes, screening may still be helpful. Otherwise, talk to your doctor about stopping. Focus on breast self-awareness instead. Dr. Lena Rogers, oncology nurse. We want women to live well, not just live afraid. Chapter 5. Bone density tests. Not always necessary. Bone density tests, or DEXA scans, are commonly pushed onto seniors, especially women. They measure risk for osteoporosis, but here's the catch. After 70, bone loss is common and expected, and the medications used to treat it are not always safe for seniors. The problem with bone medications. Drugs like bisphosphonates or injections like Prolia can cause jawbone death, thigh fractures, esophageal problems, muscle and joint pain. Plus, many people are diagnosed with osteopenia, a halfway point, and are put on meds they don't need. Who should get bone tests? You should test if you've had a recent fracture, you're underweight, you're on steroids or thyroid medications. Otherwise, focus on balance, strength training, calcium, and vitamin D. Prevent falls. That's more effective than pills. Final chapter. The real goal. Living well, not just living long. We often believe more tests equals better health. But after 70, the goal changes. It's no longer about finding every little thing. It's about staying mobile, being independent, enjoying time with loved ones, and avoiding unnecessary suffering. Key takeaway. Always ask your doctor, will this test change how we treat me? What are the risks of doing this and of not doing it? Is this test appropriate for someone my age and health status? Because real wisdom is knowing when to say no. Summary. The 5 checkups to think twice about after 70. 1. Full body scans often create panic over nothing. 2. PSA tests for prostate can lead to unnecessary, harmful treatments. 3. Colonoscopies after 75. Risk of complications often outweighs the benefit. 4. Mammograms after 75 to 80 may detect harmless cancers and cause overtreatment. 5. Bone density tests common, but meds can cause more harm than good. Growing older doesn't mean giving up on health. It means choosing wise health. It means asking better questions and focusing on the moments that matter most. Because sometimes the best checkup is not checking at all.